Right. So before that, a few warm-up questions will be there. So I just ask one or two warm-up questions. Are you ready for it?
Yes, ma'am.
Right. So in your profession, what all the skills that you have learned? What more do you need to learn?
Well, in my profession, it is basically the skill which is needed for the patient care, like carrying out procedures with the patient. The main thing is regarding communication, how to communicate with the patient, and performing or assisting the procedures, assisting doctors for performing procedures, as well as certain procedures like basic care of the patient, medication administration. These are some of the procedures which we need to do it.
All right. What more skills do you need to learn?
The main skill is dealing with the patient by proper communication and carrying out certain procedures for
That's what. Do you possess all the skills that your profession needs?
yes, what type of skill you want to clarify on it, ma'am?
All right. I'll move on to the next question. The question to you is: did you face any, hard or a difficult situation, or any irate patients or superiors who were, being rude or dominant in your workplace? How did you handle such a situation?
Well, many a times I come across with this rude patients when they approach in the casualty, because casualty is such a place where the patient and the relatives they come with a in a panic state, and they want immediate treatment. So we need to calm down, help them, talk them, and then after talking to them in a very polite and calm way, they definitely come to a state where they can understand and listen to us. First we need to make them calm. So nothing much difficult, but I do. But in case if they are beyond my control, then I have to approach my seniors, or I may have to take help of security and the other people, those who are around in at the workplace. That is how I can handle.
Well, Padmaja, good to know that. We'll move on to the card speaking. The first card, it is about the 50-year-old patient admitted for the bronchitis. So if you're ready for this card, we could start to speak.
Yes, ma'am. I'm ready for this.
Yeah, you could start.
Good morning. I am Nurse Padmaja here. Welcome to our clinic. Can I know your name, please?
A very good morning, Nurse Padmaja. I'm 50 years old. My name is Shirley, and I'm an entrepreneur. My business needs a lot of compassion, and I need to be calm and composed. But definitely, it is a stressful business, I could say. So mostly, I just got into the habit. I can say I'm addicted to drinking, social drinker, as well as smoking. Smoking, I'm really addicted. So I feel that I face some kind of chest infection and cough, and it's quite severe. So that's the reason I've, in the hospital to know what is the further treatment and recovery period.
Well, Shirley, I need to ask you some more questions. Like, if you can share your information related to the symptoms, what problem you are facing at present, like with what health issues you have come.
As far as the health issues are concerned, I could say that I get continuous cough, right? Sometimes chest pain. Because of cigarette smoking is the main cause and reason, I believe. Sometimes I have shortness of breath and slight fever to moderate fever. A lot of just discomfort and fatigue is there.
Your information, and it would definitely help me to examine you or go through the case notes as well as the information what you have shared, from where I can diagnose that, or I can say that you are having some breathing difficulty or uh, um, lung related problem, maybe a slight information as it is mentioned in the case note. So I would like to know your habits, your daily routine, how you go about, and your family history, diet. Can you share this information with me?
Yes, as far as my family is concerned, yes, I'm 50 years old. My parents are no more, and I had seen my father is into chain smoking, and maybe I have inherited that. I'm single. I'm not married. For me, business is everything.
Well, Shirley, thank you for sharing this information. I would like to say that as you are undergoing a lot of stress, and this may be one of the reasons where you would get into a smoking. But don't worry, we are there to help you, and I can help you to resolve your problem as with this problem you have approached
But
us.
nurse,
So
so far you have not told me what is the problem is about, how long would it take to get cured, and is it a chronic problem, or is it curable, and what am I supposed to do? Do I need to change my diet, or get into medication? I'm not told anything so far from your side.
well, surely you did not mention regarding the diet what you are taking, but you surely told me that you're 50-year-old and you have got into smoking. Maybe I would like to know regarding whether do you skip your diet many a times, maybe due to your
No,
job
as far
or
as
diseases.
diet is concerned, I know because I'm a business person. I just keep eating whatever I get wherever I go. So there is no proper time to eat or anything.
Well, how many, as you said that you smoke, but can I know how many times do you smoke in a day? Or
I think you didn't hear any of the information I had given clearly. I'm addicted. I'm a chain smoker. I told very clearly.
well, thank you, Shirley. I'll explain to you regarding the problems you are concerned, but not. Your case note reveals that you have bronchi, and hence, after ruling out with the help of investigations, the doctor will
Thank
be
you,
in better
Padmaja, for your
position.
participation. 5 minutes and more, it is, it's almost 7 minutes. So 1 minute if we deduct it for the starting warm-up question, also 6 minutes you have spoken. Thank you for your participation. Well, I just want to move on to the next card. Are you ready for this next card? We do the role play. It is about a 28-year-old heavy, drinker. That person has got admitted in the hospital for cirrhosis.
Yes, ma'am.
Right, you could start it.
Good morning. I'm Nurse Padmaja here.
Right. Good morning. I'm Adam. I'm 28 years old.
Well, Adam, what made you to visit our clinic? Can I help you?
Right. I experience a lot of discomfort and pain, and because I suffer from some kind of chronic liver infection, I believe. So that's the reason I visited the hospital, because continuous pain is there, and some kind of uneasiness I feel. So I just want to check what really happened to me.
Well, in order to get a better understanding of your problem, let me know some information. I would like to get some information regarding your family and your health as well as your home. If you could share it.
Yes, I'm just living with my family. My parents are there, and but I'm a working person. I stay away from. I'm living in another country, and I started to develop some kind of signs and symptoms almost for the 3-4 months. Some severe abdominal pain, nausea, loss of appetite, and weight loss is there, and also some kind of swelling in the legs, extreme tiredness, and sometimes it is quite confusing me what is the real problem.
If you, I mean, from whatever the information you have given me, I would like to gather some more information regarding whether you are drinking or smoking.
Yes,
If you would.
I'm into a lot of drinking. I could say I'm almost addicted.
Well, thank you very much for sharing your personal information. But not to worry, I will be there to help you out. And it is like drinking. If you can quit, this may be maybe you're drinking, maybe you're cause for having an abdominal pain. So after examination, we can very well rule out what is the cause or what are the health problem, and hence, first of all, I would like to tell you that if you can quit this as drinking, and I that will be much better for your health, and hopefully by having a good friends who can help you out to quit from this alcohol or drinking, it will you will be much all right, or you will overcome this health issues. If you don't mind, can I share more information on how you can uh, quit drinking?
Yes, first of all, I want to know what is the problem, how it is called, and what is the cause and reason for it, how to overcome it, and how long would it take for me to recover.
Well, I would like to give you information. Thank you very much. This is a nice question where I can help you out. Firstly, I would like to tell you that drinking is one of the cause where it affects the liver and it gives a swelling. It enlarges and it disturbs the liver cell, and hence the individual may face problem regarding the abdominal pain, which may be the first sign. And as you said that you are drinking since long time, it must have had more effect on the liver, but not to worry. There are ways and means to overcome this problem. So there is a alcoholic anonymous group where you can um, have some friends who will help you out to quit from this drinking habit. Well, I think you may be clear about this, that what causes the abdominal pain. Are you clear?
Yeah, I got it, but how do I control it? Is it treatable?
Yes, it can be treatable. Not to worry, but it will take little time. Maybe 1 or 2 months you may take. It is up to you how you can overcome, because it is your inner feeling. Definitely, you may get that urge to drink, but with the help of like um, support groups. Now, one of the support group which is called as Alcoholic Anonymous group, where the people they come together, those who have already come across with such type of problems and they have overcome their this habit of drinking. So these are the people who can help you out to quit from
Well,
drinking.
Padmaja, thank you for your participation. We are crossing 6 minutes time. Thank you.
Thank you, ma'am.
Yeah. So both the cards, I believe that you have crossed more than 6 minutes and you didn't come to the point directly. See, I felt like more like you were asking questions rather going to the point of, see, first of all, you have to tell what is the problem name is, cirrhosis. What is cirrhosis? It is a kind of, liver damage, due to, as the person is into drinking and smoking. It is a kind of liver damage. So liver is failure of the liver, the scarring of the liver, the damage that it has caused. And also the most other common reasons for the cirrhosis could be, hepatitis or other virus, and alcohol abuse could be one of the reasons, as a person is into alcohol, drunkard. And also, as I told that, how do I experience what all the problems, then you have to this abdominal pain, nausea, and tiredness and weakness and the swelling and some kind of confusion I have. So it is all called, it is all the symptoms of the fatty liver disease. Okay, so that information you have to share. Well, thanks for sharing the information. Whatever the problem that you experience, it is mainly because of the fatty liver that you have. The fatty liver is mainly because of due to over drinking or other virus infection, or hepatitis also could be one of the reasons. But I believe as of now, as you are into drinking and you're only 28 years old, so you might have experienced this, due to a chronic liver damage. There are other reasons also. So liver failure will be there. So immediate treatment is required. So you have to go for the treatment. There are stages, the liver disease could be inflammation, fibrosis, or cirrhosis. So cirrhosis, it's a third stage. So definitely you have to get into, treatment. It is, you could be treated, but, we could not say that 100% it is curable. So your cooperation on time is needed, and sometimes it could be fatal too. So it is treatment on time. Cirrhosis is the third stage, so you definitely need to be treated. Especially drinking problem that you have to quit. For that, the only thing is Alcoholic Anonymous, that program we conduct. You have to join that. That would be more helpful to you. Rehabilitation center is safe. Okay. And with regard to family history, if you are asking the patient that do anyone at home smoke or drink, what type of family that you live, what is your other habit? Do you have, what about your diet and exercise, and what is your nature of job, that you missed to ask? So that information, okay?
Okay, ma'am.
Right. So this is these information, because cirrhosis is stage 3. Do you know it or not?
Yes, ma'am.
Yeah, that you didn't say. The fourth stages, liver failure will be there. First, it starts with inflammation and fibrosis and cirrhosis. Cirrhosis is the third stage. So if you ignore it, so it is generally chances for it, because liver fat in the liver, it will clog, and the total failure of the liver will be there, and seriousness of it is it could be fatal. So you have to ensure that patient is realizing it. And next to that, when you speak about the bronchitis also, you have to say what is the cause and reason for the bronchitis, and because the chest X-ray to be done in order to is there any pneumonia? Is it showing up of pneumonia infection, and whether it is acute bronchitis or what is the real condition as of now? And most probably twice you asked, what about your habit? I already started by saying that I'm a chain smoker, I'm into smoking. That you missed again, you were asking how many cigarettes. See, when a person is addicted, when a person is chain smoker, they don't have a count. Packets and packets they smoke. Okay, so it's irrelevant to ask how many do you smoke. Okay, that is called addiction. Addiction means a person cannot have a count of. They keep drinking and smoking whenever they feel whatever their mind says.
Okay, ma'am.
Okay, and about the bronchitis also, I told that I have the cough and fatigue, shortness of breath, and fever is there at times, and the chest discomfort is there. So these are all the chronic bronchitis signs and symptoms of. So when it is in the chronic stage, is it curable or not? But generally, bronchitis, it cannot be cured. All these kind of chronic diseases cannot be cured, but it could be treated. A lot of medication that could be helpful too, and smoking, not only smoking, could be even environment, air pollution. So as you're from medical field, you should not only take that. You could say that maybe other reasons also, air pollution, smoky environment that you live in. If you live in a place where construction work is going on, there is a lot of chance. So that also you have to rule out. But as of now, as you are into continuous smoking, that has clogged your liver, and function of it is affected. So definitely treatment is required.
Okay, ma'am, but I have one doubt regarding this card. As you have given in this card that the patient is 50-year-old and admitted with bronchitis, it doesn't say that there is some chronic bronchitis. So how do I understand this, whether it is a chronic or an acute?
You have to
bronchitis?
understand by the symptoms told by the patient. As a patient, I told, when you ask, I said, no, the cough, fatigues, shortness of breath, these are all your presence of mind.
No, but this is like acute bronchitis. This is not for the chronic bronchitis.
Which one?
That is my, the symptoms, whatever it is being told by the patient for bronchitis, these all symptoms
Actually,
are
whether it is acute or chronic, both are same. The severity differs, mildness to moderate to severe.
Yes, and here it is given as further to the examination, like with the X-ray and computerized.
Yeah,
But
you didn't speak about that X-ray, why the X-ray can be taken, and by X-ray, what all the things that we confirm. You didn't say anything.
it is no, because I have gone. It is said that the test result to the patient and inform that the doctor will provide a diagnosis. So whether I am supposed to give information is been given for the test results on this X-ray and computer scan.
No, that is all the thing. What is that? How do you confirm by CT scan, right?
Achha.
What do you do? CT or MRI is required. So by doing CT, you are going to confirm it.
But that confirmation of the diagnosis will be definitely provided by the
See, actually, as per your card, if you
doctor.
see what is your task, you have to collect the basic detail about family, patient, habit. This should happen in the very first dialogue, but you were on and on like question answer session, step by step. You were asking that you have to overcome. And finally, most importantly, you should start to respond to patient's question. That is the priority here. So whatever the question asked by the patient, accordingly you have to respond. So preparing the card only 60 to 70%. Another 30%, there only you will get the maximum score. How do you respond? What question is asked by the interlocutor? How do you answer precisely, correctly? Okay, and also you have to provide information regarding, how to give up smoking because the patient says that I'm addicted. So somebody who is addicted, it is not that is even coffee drinking also. If you are addicted, say 2 cups of coffee a day, it's fine. But if you drink 4 or 5 cups, it is addiction. So so that is fine. But some people are there, every 1 hour they keep drinking, every half an hour they drink even coffee too. That is severe addiction. Addiction is something whenever knowingly, unknowingly, they just keep doing it. That is called addiction. Though they want to come out of it. So one person has got addicted to drinking and smoking, just like you have to go for nicotine patch or gums or that would not help. So addiction can be cured only by the addiction centers, rehabilitation centers, and so that is the only option for them. No, because continuous monetization and proper food, exercise, and counseling. So for that, being a member and they have to enroll because any addiction, at least a couple of weeks they have to participate in all the programs. Then only it could be. Right, and also you have to advise a positive and friendly way. What is a positive friendly way? You said by saying others, by saying others. More than that, you have to come out, you have to fix in your mind, you have to quit. I know that 50 years you are into addictor, you are addicted, but it is not that easy to quit. But now it is a high time. The bronchitis is not an easy thing. It is quite dangerous. So it is an like death alarm. That is kind of a serious thing. So you have to, if your life is important, you want to lead a quality life. So these all the thing in a positive and optimistic way. You have to counsel.
Okay.
And you have to, the test result, finally it's given, brief the test result to the patient and inform that the doctor will provide that. Because everything you cannot be spoken and you have to say, doctor, because you have gathered information, based on the information you are counseling, you are advising, you are recommending, you are suggesting, you are ensuring. But what is further, how serious it is, only by test result we confirm. Based on the treatment and everything would be recommended by the doctor. That is the final information. But prior to that, when almost off of it itself, I made you to stop because you didn't come to the point as usual. 6 minutes, it got over. 5 minutes only.